there is a very to, there is no such difference precisely if we can say that they both are considered, they both are talk therapies, and they both are used when a person is in emotional distress or he's facing a social issues, developmental stress, or there are certain life concerns. Like if somebody is going through some problems within his life, if he has gone through problems during his developmental period, early life, or socially if he's facing some problem, and the life concern if he is if he has some concerns regarding his business, regarding his personal life, and he's stressed out because of those things. And beside that, if somebody is having mental health problems like mental health disorder, if somebody has diagnosed problem like depressive disorder, anxiety disorder, or any other problem, then this counseling and psychotherapies are used. So, what are the various differentiating features between counseling and psychotherapy? Counseling in itself is a short-term therapy between weeks to maximum 6 months. It is a type of talk therapy which focuses on present problem and situation. What is the actual problem at the moment? That is discussed and talked about in counseling. It is a specific and situation, it is specific towards situation or behavior. If somebody is exhibiting some behavioral issues, or if somebody is having some issues to a particular situation, then this counseling is used. The main purpose of this counseling is to guide, support, and educate to help people identify and to find their own solution to current problems. However, the psychotherapy is a long-term therapy, and it is used for chronic or recurrent problems. If someone is going through some problem, or if he has failed in counseling and didn't respond on counseling, or there are certain patterns that is affecting his life as whole is affected, then this psychotherapy is opted by is I would say that this is recommended by the psychiatrist to go for a psychotherapy. It is an the in-depth focus on internal thoughts, internal feelings leading to personal growth. So this is mainly concerned with feelings and emotions and experience focused. In the counseling, this is only a talk therapy. However, in psychotherapy, it may include psychological testing like personality assessment. So this is a bit in-depth therapy. For a counseling, you just need certain diplomas. However, for the psychotherapy, one has to uh, go through this a master's in psychology and then clinical psychology. So a psychotherapist is a psychologist. However, the counselor can be anyone who's getting a diploma in counseling. So what are the different types of counseling? As we said that the counseling is more focused to current problem. So if somebody is going through problems in relationships, so that can be dealt with counseling. If somebody is in grief, he or she has lost something, lost a spouse or another important person in their life, or they are in grief, so that is bereavement counseling. If somebody has come from a war-like situation and he's experienced anxiety symptoms. So then the debriefing is advised. Then there comes the genetic counseling and the crisis intervention. Genetic counseling comprises if someone has, if some family has a history of, they have a kid with autism and now they are conceiving again, so then they are referred for genetic counseling. The mother might be feeling anxious for the second pregnancy. Then comes the crisis intervention. If somebody faces some loss, change of role, if somebody got some promotion or demotion, and there are conflicts within the with for the person, then these crisis interventions are used as types of counseling. Whereas in psychotherapy, these are the most specialized type of therapies like supportive therapy, behavioral therapy, cognitive behavioral therapy, psychoanalytical psychotherapy, interpersonal therapy, family and couple therapy. At the level of fourth year, if you can just remember the names of few, that'll be enough. But if you want to know a little bit more about the therapies, then supportive therapy is considered as a surface therapy, is the superficial therapy, in which the therapist help the patient to relieve emotional distress and symptoms without probing into past. He's the main focus is just to encourage hope and self-help. That's a little about supportive therapy. As far as the behavioral therapy is concerned, the J.B. Watson was the main person who, the father of behavioral therapy. The types of it is a type of therapy which is based on theories of learning, that all behaviors are acquired or received through conditioning, and it aims at modifying maladaptive behavior. As far as the cognitive behavioral therapy, let me give you the examples of behavioral therapy first. So behavioral therapy is usually used in anxiety disorders, and the examples are like flooding. If somebody is scared of heights, and you just give him that experience of, you just make him stand on the highest point. So that is flooding, and then systemic desensitization. Then comes the cognitive behavioral therapy. It's a short-term, goal-oriented psychotherapy that takes a hands-on practical approach to problem solving. Mainly, Aaron Beck is the father of cognitive behavioral therapy, and the main aim of the cognitive behavioral therapy, or the CBT, is to change how you feel by changing the way you think. If you think that you are a failure, you'll feel sad. So that thinking pattern is changed with the help of cognitive behavioral therapy. Then comes the oldest of the therapy, the psychoanalytical therapy. This is a very old style of therapy, and that requires many sessions. If somebody is, and the main focus is that the traumatic experiences, the main crux of this psychoanalytical therapy is that the traumatic experiences, especially in early life, give rise to psychological conflicts. The greater part of the mental activity is unconscious, and the conscious mind is protected from experience of this conflict by the inbuilt defense mechanism that we have. So that decreases the anxiety. So that psychotherapy focuses on talking about those experiences, traumatic experiences, and building them, and then bringing them to conscious level, and then to resolve those conflicts. But it is a long-term therapy. It takes years. So that's why mostly at these days, cognitive behavioral therapy is used, which is preferred at this moment. With all those therapies, the most important component that one should have is the empathy. Empathy is the ability to recognize, to understand, and to share the thoughts and feelings of other person or animal. If you cannot understand the feelings of the other, if you cannot uh, recognize the feelings of the other person who is in therapy with you, then you won't be able to connect with that person, with that patient. So, what are the difference between sympathy and empathy? That is mostly asked, but and looks similar, but it's not similar. Sympathy is feeling sad or feeling sorrow for someone's misfortune, like, oh, I'm really sorry, so you have lost this thing. So this is like feeling sad or feeling sorrow, or and that is sympathy for somebody else. However, in the empathy, it is like you identify or you try to understand or you can feel the another person's situations and how the another person is feeling at the moment. Sympathy, in the sympathy, in the person not necessarily understand the situation, the other person situation. However, if somebody is an empathic person, so he can understand the feelings of the other person. In the empathy, the person may have similar experience, may have faced similar experience in his past. However, sympathy, it doesn't mean that they have that similar experience in the past. In the empathy, the understanding and acceptance are evoked. However, in the sympathy, usually the sorrow, the pity, or the concerns are evoked. So these are the basic differences between sympathy and empathy. So, what are the benefits of counseling or what are the benefits of psychotherapy? It actually helps the person to understand himself. When we are in a crisis situation, when we are in a stressful situation, usually it is like a dark circle around us. So, and we perceive ourselves as a negative person. We'll just recall all the negativities of our lives. We just forget what we have done good for us and for others. So, in that situation, counseling or the psychotherapy helps the person to understand himself, and it allows the person to help himself or herself. It'll facilitate to look at the situation with a new perspective. Like we just said, that if a person is in depressive disorder or going through some hard time, he'll see himself as a failure, like in exams, mostly in exam situation, if we just focus about that particular situation in which the counseling is advised at the times, like a student is going to appear in his final exams, and he is anxious, he or she is anxious, and they feel like they'll fail. So this anxiety will turn a vicious circle and they'll feel anxious, they'll develop the physical symptoms of that anxiety. In that particular situation, the counseling will help to facilitate to look at the situation with a newer perspective, and it develops a positive outlook in that person, and it will motivate to search for the alternate solutions or alternate options, prepare the person to cope with the situation and the related stressors at that moment, and even after that, if a person faces situation and is in the same sort of situation in future or next any other time. These are the basic counseling skills that even if your colleague or your friend is in stress, even you can experience, even you can try These things, these are the basic skills that you should know and to help a person who is in need. So first of all comes the listening. So you need to listen. Actually, we talk much, we don't listen much. We should be listening to that person. However, most of the time, what we have seen is that we start just giving suggestions or arguments or our very valuable comments. But whenever a person is in stress, you are supposed to listen that person and demonstrate empathy. Try to feel what the other person is feeling. Try to understand that other person's emotions and do not make judgments that this all happens. This happens with everybody. Life is so rough. You are just you do just no need to cry or anything. Do not make judgments. Understand the emotions and the feeling behind the story of the person being counseled. If you need to question, then it should be you should be questioning with care and try to ask open-ended questions. Excuse me. Then reflecting back is if somebody is telling you about his or her problem, then you'll reflect back. Okay, you have told me this, and this, and so this is reflecting back. So that will help the other person who is in stress, that you are listening carefully and you know what the other person is talking. Then the summarizing all the things and the paraphrasing, like if somebody is saying that he is in stress, then you will paraphrase, okay, so you are saying that you were in that time, you were really in stressful situation. So that the understanding is correct, so that the both are understanding each other and the complete. Use appropriate body language. You shouldn't be using your cell phone when the other person who is in stress is talking to you. So you need to be very careful. Or you don't be like looking at your watch that okay, this is enough, I need to go. These all are the gestures that we usually give. Do not show superiority or patronage. These are the basic counseling skills. The next is don'ts of the counseling. What we shouldn't be doing. Don't blame. It's all your fault. You must have done something. That's why you are in trouble. You didn't study it and now you have failed. Don't judge a person on that. That these are the two main things. Never invalidate the feelings. If somebody is talking to you, at least acknowledge his feeling. Don't use you should. You should have done this. You should have done that. These are the don't words. Don't compare patient's experience. Don't give examples of your own life or of others, like somebody else has been gone through with such time. Why you are acting so like that? You are so down. This is no way you should be acting like this. So these are the don'ts of counseling, which will turn the other person down and they won't be talking to you, and the situation will go worse. So you need to be really careful about those. You need to be careful what we speak. That is really important. So when should I see a counselor? Specific, if you're facing a specific or short-term issue. If you're facing some issue like of exams, if you have gone through some issues with your friend and you are unable to solve those issues, and you feel difficulty in coping day-to-day issues, day-to-day chores, and all the other things, and you are feeling like you are not managing that stress, or you're coping with transition or adjustment. if you have shifted from one place to another and there is difficulty to adjust. If somebody else has shifted in your place or your house, and you have difficulty in adjusting with that person. If there is any transition from one class and or to another, or some transitionary issues, then you can see a counselor. As I have already mentioned, the counselor is not necessarily a psychologist. Anybody can get a diploma or the short courses of counseling, and then they can start their profession as a counselor. Excuse me. Then comes the when should I see a psychiatrist? Or sorry, when should I see a psychotherapist? So, psychotherapist, as I said, the psychotherapist is a psychologist who has done masters in clinical psychology. The psychotherapist is not a doctor. Few psychologists, when they do their PhD, they do write their like doctor before their name. However, they are not the medical doctors. And the psychiatrists, on the other hand, they are the medical doctors. They have done their MBBS and then the post graduation, and then they are the psychiatrist. So, when should I see a psychotherapist? Is One needs to see a psychotherapist when he or she feels that that particular stress or that particular uh, problem is impacting his life or relationship. His whole life is affected with that issue. The trauma is affecting his current day-to-day life events. If the thing is chronic and recurring, if a person is facing recurring concern and it is not resolved, then he can go see a psychotherapist. If there is any chronic medical condition, most of the time when somebody has a chronic pain disorder, or if somebody has a chronic medical illness like diabetes or arthritis that is affecting his life or the well-being, if somebody has developed a cancer, or he or she is on dialysis, so these are the chronic medical conditions. They do affect the well-being of a person, and when the well-being is affected, you are supposed to see a psychotherapist who can help you see the better picture of the life. Or if somebody has developed a mental health disorder, like a diagnosed mental health disorder, like depressive disorder, anxiety disorder, or any other mental health disorder, and they can see a psychotherapist, refer to a psychotherapist, or when the issues are not improving with all the efforts and all that. So, in the end, the last slide that I want to mention here, that there are so many reasons why you choose to see a counselor or a psychotherapist. But the most important thing is getting started, getting help. This is really helpful. This is the basic step. So one should keep his hopes high and do see a proper help, a proper qualified person, rather than going to other places. I know trusting a person is not an easy job. Trusting a person whom you have never met is not an easy thing to do. But you can look around. It's your, after all, it's your emotions, your feelings, and you cannot just talk to anybody for that thing. A perfect therapist for someone else might not be a good fit for you. So you should look around for a perfect doctor whom you can talk to and keep your hopes high.